Welcome to today's webinar from OSB Labs. Today's webinar is focused on restoring healthcare staffing for the future amidst this COVID-19 dilemma that we are in. Before we begin, I'd like to do some housekeeping. I would like to go over a few housekeeping items so you know how to participate in today's event. Towards the end of the webinar, you'll have the opportunity to submit your questions. To do so, just type your question into the Q&A at the bottom of the control panel. We will address as many questions as we can during the Q&A session. At the end of the webinar, we will be recording this. At the end of the webinar, we will be recording this webinar and we'll share the link a few days after the event, and it'll be on our website. So without further delay, I would like now to introduce you to our speaker for today, Stephen Cater. He is the CEO of Sterling Staffing Solutions and White Orchard Hospice. So based on that, let me give a little intro to Stephen's background. Besides Sterling and Staffing Solutions, Stephen runs an entrepreneurship consulting firm and a hospice company providing palliative and hospice services with his twin brother, Dr. Sterling. They have co-written and authored a book together entitled Double Your Success, Principles to Build a Multi-million-dollar Business. Together, they run multiple businesses, including an online magazine, an event promotions company, a beauty salon, a jazz lounge, a restaurant, and a full-service accounting and tax company. Today, let's hear, again, Stephen's views and insights about entrepreneurship, his healthcare business, how things have changed since this COVID-19 crisis. So Stephen, welcome. And,
thank you, Nick.
I will turn this over to you.
Very excited to be here, Nick. Thanks for the introduction. I appreciate it. My brother, Dr. Sterling Carter, and I have been serial entrepreneurs for a long time. So some of the businesses that you mentioned in the introduction were some that we had early on, but now we are more in the healthcare space, and we have multiple physical therapy outpatient clinics, mobile physical therapy business. Like you mentioned, White Orchid Hospice, which is a terminal care system service for terminal patients in the Houston and Corpus Christi area. And then mostly what we're speaking of today is our healthcare staffing company and what we've been able to do with that company, and then how we're pivoting into the use of technology to even be more relevant in this pre-post, during COVID-19 moment that we find ourselves in. So thanks to you and OSB Labs for having me on. I'm excited to be here.
You're welcome. And let me make a correction. I do apologize. There was a typo and I said Cater, it's Carter. So yeah, so I apologize about it. Okay, so let's start off. We have our first question. Stephen, with a business administration degree in accounting and an MBA in change management and finance, what made you move into staffing after spending 21 years in a different field?
Well, Nick, it was really opportunity, to be honest. There was an opportunity that presented itself, a business opportunity presented itself. There was a demand. My brother and I were contemplating what business that we wanted to get into. He was operating outpatient physical therapy clinics at the time, and he was being approached by a number of home health agencies that were looking for physical therapists to come and see their patients in their homes. And at the time he was operating his own clinic, didn't have time to do that, so he was kind of passing on those opportunities. But he also had colleagues that were coming to him and saying, hey, do you know of any job opportunities? We're looking for something to do. And so he was kind of just making those matches happen just through his network to, match people that needed a job with the company that was calling, and realized that there was a need for staffing. specifically in this niche market. And, as they say, riches are in niches, right? So there's a niche market
Excellent.
For healthcare staffing for home health. And he found that opportunity. At the time I was still in corporate America. He brought it to me and said, hey, I've got this idea. I just need a little financing for that. And with me having a business background and working in corporate for a long period of time, the beautiful thing about working in corporate America, you know this as well, Nick, is that you're learning all of the great newest process improvements, agile works, all these different concepts, right, that are not as relevant in a small business atmosphere, because most small business owners are just trying to make it day to day, right? So I was able to apply some of those very complex business models and methodologies and strategies to our business, which is what I think helped us elevate and move so quickly in the space. So, what you find in healthcare as well, which is another dilemma, is that a lot of healthcare owners are healthcare clinicians themselves, and they're great at serving people and taking care of the patient in bedside manner, but they really struggle with business acumen, right? Yes. And so my brother he has his doctorate in physical therapy, and I have an MBA in finance and change management. We were able to blend the two, and we're able to kind of hit a home run because we had the clinical and the business mindset, and it was a great opportunity.
Exactly. And based upon my experience, people working in clinical will gravitate more towards people that have at least an awareness and some level of knowledge of their industry, because it is unique and there's many different facets. Your background in change management and finance and everything you've done thus far, it is very, very, today you're the typical person that companies are looking for. I hate to use the phrase jack of all trades, master of many. That's the change I'll make. So thank you, Stephen, for that answer. The second question, what were some of the staffing challenges you faced when you began your career in staffing, and how did you overcome that with technology?
That's a great question, Nick. And I think back, we started our staffing company in 2011. And, one of the things that I thought was going on then, and I still believe is the case now, is that healthcare is still antiquated from a technology perspective. Even though, from a healthcare perspective, obviously you would think that, clinically, medically, we're trying to find the newest solutions to things like COVID-19, curing cancer, all of, so there's obviously that type of research that's going on, but the use of technology in healthcare has always been a little bit behind, right? As you think about COVID-19 right now, we're just now getting people to really take a hold of telehealth. And that's something that's been around for quite some time. We can never push the industry to go into a telehealth method. So to answer your question, when we first came in healthcare staffing, we found it to be antiquated, and our leg up was using technology to get ahead. When you think about healthcare staffing, the biggest thing about healthcare from a clinical standpoint is that clinicians are concerned about their livelihood. They know that if they do anything that's fraudulent or anything that may harm the patient, they can put their livelihood on the line, right? So if they work for a company, they want to make sure that they can trust that that company has their best interest in mind. And a lot of these healthcare people have been burned by the corporate mentality, which is really focused just on profit, and they don't care. They'll throw the clinician to the side just to make sure that they make a profit margin, right?
Yes.
And so we always kind of felt like we wanted to be, clinician owned and operated. My brother being a physical therapist, we wanted to promote the fact that we understand from a clinical standpoint what's important. But obviously from a business perspective, this is business, and everyone has to make a profit to stay in business. So our clients wanted accessibility to clinicians in a quick manner. They wanted to be able to get their billing out, their notes done as quickly as possible. And they wanted to be able to understand what their margins were, right? And so the only way for us to do that was to develop a system that allowed us to communicate and change the effectiveness and the efficiency of our staffing model that allowed for us to offer ultimately a lower price to our clients because we didn't have to use as much manual labor to get the job done, because we took all of that manual stuff and we automated it into a technology system. And at the same time, it ensured that we were able to take care of our clinicians and make sure that they were always protected and paid on time and things of that nature. And it allowed us also to have a brand of taking care of both the clinician and the client. Ultimately, leveraging technology really was the game changer for our staffing company that launched us from being just a smaller company in the very beginning to literally within just a few years to be one of the top healthcare staffing companies in our niche within our region, and which many people would think they felt like it was overnight. They just didn't see us coming. But it was over a course of a few years, but we were able to use technology to really move the needle.
So basically, let me just sort of kind of paraphrase.
Yeah.
So basically what you did was you leveraged technology, but technology in a way where it brought efficiencies to servicing patients via, the whole realm of clinical care, without giving the clinical staff the impression that, technology is our focus.
Right.
So technology was somewhat stealth in terms of how you enable these efficiencies. Is that a fair summation?
Absolutely, Nick, and I like the word stealth. It was. I mean, we wanted it to be a seamless pipeline. There's a seamless way to make it more efficient for a lot of people. There was definitely a learning curve and a transition period for some. Some of our staff that had been in business for a long time used to doing all of their paperwork on paper instead of electronically. So there was definitely a learning curve there. But once we kind of went through that change management process and they got to the other end, everyone was much happier.
Yeah, no, excellent. Because there's not too many organizations like yours, Stephen, that approach it from a change management approach and yet being sensitive to the core business. Excellent. The next question is, your company offers staffing services in rural areas as well. Have you faced any challenges? What differences do you see in the staffing needs in rural versus urban or semi-urban areas?
Yeah, that's a great question, Nick, and it's interesting because that's really how we were able to begin our business in a very competitive landscape. So when we first started out, there were a lot of competitors in the healthcare staffing world, and most were focused on the urban inner city areas because that's where you have the most residents, right? Most people live within the city limits. And so knowing that was a highly competitive landscape, we thought that our niche would be, let's start and focus on the rural areas, the suburban areas where the competition is not as steep, and where we know that there are patients that are there that need care. And we can kind of tout to our clients that we can cover you no matter where your patient stays. We're allowing you to be able to access a larger client patient pool than you normally would be, because you'd have to turn away these patients in the past because you couldn't access them. We're gonna take care of that for you. But the mentality in a rural area is much different, right? So residents move to that area because they want the calm, serene atmosphere. They want to be away from the hustle and bustle. They want a slower lifestyle, right? The less stress. And so finding clinicians that either worked or lived in that area is difficult. So that became our own set of challenges, right? Is trying to find clinicians that were either willing to travel to those rural areas, or clinicians that lived in those areas that were there for the same reasons that the residents were. And these residents still want top quality care. Just because they live in a rural area doesn't mean that they don't want access to the same quality care that you can get within the city. So it was a need to blend those two. But that was additionally how we leveraged technology as well, is because we built basically a database of clinicians both in rural areas and in inner city areas. And because we built this tool, we were able to easily say, okay, you need a clinician to go see someone in, Humble, Texas, which is, that's rural for us in Houston. In a matter of seconds, we could tell them what discipline we had, which patient we had, which clinician we had, how quickly they could get out, and just leveraging technology. And whether or not we could say we could take care of that need or not, we were able to answer that question quickly. And our clients appreciated it because they just tell me one way or another, can you help me or not? And then when we could, it was a game changer.
Yeah, particularly in the area of, say, pediatrics.
Yes.
If you're living in a rural area, it's I hate to say medically more complicated, but it is different than adults versus pediatrics. Just a follow-up question. Did you find with dealing with these rural areas that individuals who resided there, that they gravitated more towards using the technology as compared to people in people in urban areas where they could get up, hop in their car, and go down the block, and there's a medical facility?
That's a good question, and I think that the move to telehealth now is just really starting to happen for us at this moment. I think that from a patient standpoint, in the niche that we're in, because we send our clinicians to see patients in their homes mostly, that technology never was an issue that they had to worry about as a patient. But from the clinical side, being able to immediately accept an assignment and know exactly when and where that was going to happen and how much they were going to be compensated for that, it definitely was a game changer for them. Yeah. It eased, for in the rural areas, obviously job opportunities are less or scarce there.
Yes.
More so there's not as many opportunities there as it may be in the city. So having an opportunity to get access to work was very beneficial for those people.
I agree with you wholeheartedly. The next question, and this gets to the heart how COVID-19 has changed, has permeated and changed every facet of how we live, how we work, how we just interact with one another. So how has life changed for you specifically since the advent of COVID-19?
The biggest change, and I think this is the change that I think everyone has experienced, is the remote working, the use of Zoom on a daily basis. But honestly, our team, COVID-19 has impacted our team to move to a more virtual standpoint. And, it's been actually rewarding in a lot of ways. One is that I think that from a productivity standpoint, we do have some employees that get a lot more done from home than they do at work. And it honestly, even for me, and I think I'm a tech guy, I still was old school. I still felt like I wanted to see my team in the office. I wanted to watch them so I could come look over their shoulder if I needed to make sure that they were working. But, if you hire the right people and they're doing it and they're committed and they're in it for the right reason, we've seen productivity increase. We've seen, sense of accomplishment, increase. They have more time to spend with their family, which makes them happier overall.
Yes.
But we've also still tried to incorporate, team events or things to get people to still have that social aspect of what they miss from being face to face, right? But I would definitely say the virtual operations has been the biggest change for COVID-19. Specifically to home healthcare, obviously our healthcare model is tough right now in that niche, right? COVID-19 has made it very difficult or very scary for patients. They don't want someone coming into their home that they don't know, they don't trust, they don't know, and vice versa. Our clinicians don't want to go into someone's home that they don't know and don't, so
Exactly.
trying to get into a new normal for everyone, to say our new normal is that, we can't just all stay at, I'm not trying to get political or anything like that, but just saying that
No,
new
I
normal,
agree with you. Yeah.
Yeah, we can't just stay at home, right? We've got to live our lives. We've got to figure out how to be safe about that. But we can't just let our economy, our way of living, grind to a halt. So how do we accomplish both? We're part of the our global economy, and this globally we're the smartest people, have the most brilliant people in the world in all of these different places. We can figure this out, and that's what we're excited about.
Exactly. I mean, yeah, if we can put a man on the moon in 1969, as I said to you before, we could certainly resolve this.
Yes.
But thank you, Stephen, for the answer. Next question: what changes are you making in your business to adjust again to this situation, this COVID-19?
Yeah. So I think the buzzword that everyone continues to speak of is pivot, right? How do you pivot in this new norm, right? The challenge for business owners right now is to look at the landscape and to look into the future and to figure out, to even forecast, what are your clients going to need during and after this pandemic, and how can we adjust now to make sure we're ready for that. One of the things that we saw coming, quite some time ago, from a staffing standpoint, is the need to make it more efficient for, as we speak about home health and that niche that we're in, more efficient for our clients to get to our clinicians, right? And we're trying to automate a very antiquated staffing model where you have a team of people in the office, and agency faxes over or emails over a request for a patient, and we call and find the patient and all of that. So we decided that we wanted to turn that over and put it on its head, and we wanted to create basically a Uber app for healthcare staffing. So we came up with Home Health Pro, homehealthproapp.com. And it's a mobile app that is going to provide an avenue, a way for our clients to get in direct contact with our clinicians with minimal need for intervention between a middle party. And we're in the process. We've been working with OSP Labs on this product, and we expect for it to launch in the next 30 days. And we just think that it's going to be the new model for staffing. We've got to leverage technology to move forward, and the traditional models for staffing and things that we've seen in the past just aren't going to work.
Exactly. And can I add on to it also the recruitment necessary?
Yes. And I mean, that's we'll talk about this in a little bit, but when we talk about COVID-19 and what's going on here, we're from a healthcare standpoint, we were already at a low level of having enough supply to meet the demand. There was already a shortage of nursing, already a shortage of physicians. So now we've already got a system that has a shortage of personnel that is being overly demanded to attempt to meet the demand. You've got overworked employees, you've got burnout going on. All of these things that are happening. How do we figure out how to cope with healthcare long term to fill the shortages, change the model, make it easier for people to get into the healthcare field? That's one of the other things I think that's a big learning for COVID-19 is that we need healthcare. We need healthcare personnel. How do we fill this gap? Because it's evident now that we don't have enough.
You're absolutely right. You're absolutely right. And also too, when you look at, I hate to put it this way, but the competition for specialties, lab technicians, certain types of surgery, surgical domains, of course, nurses, you have in some cases around the country medical institutions that are actively recruiting out of another medical institution. And somehow it's going to have to be a collaborative effort to work together. So,
Absolutely. Absolutely.
so which innovations can benefit the staffing industry? What are some changes that the staffing industry has been looking forward to? I think we touched upon a few. Were there other innovations?
I think that obviously what we see happening now, that the entire model of direct care, of
Mhm.
hands, having a clinician that can touch and be right there to touch that patient, is going to be turned on its head, right? What we
Mhm.
have to figure out in 2020 and beyond is how can we deliver quality health care to patients in a automated manner, in a telehealth manner. How can we
Yes.
still, achieve the same outcomes without being in the same office with someone, right? And so I
Exactly.
think that the advancement of telehealth is going to be big. I think the advancement of AI, of artificial intelligence, I think,
Mhm.
allowing people to, you already have it happening right now, right? The internet has been amazing. You think about WebMD and some of these things, the way that,
Yes.
that a lot
Yes.
of people are able to self-diagnose, what they have going on, now is beyond what has happened, obviously, even 10 years ago. I mean, WebMD and websites like that are amazing. You plug in your symptoms, and voila, you get probably the top 5 or 10 causes that may be the case. But I think that more of that,
Exactly.
that AI tools like that to help supplement the shortages that we have in healthcare, and the use of telehealth so that we can serve more people in a quicker, faster format. That's got to be the way of the future. We've got to figure out how to leverage that and to do more of it.
Oh, exactly, Stephen. In a way that WebMD made people more knowledgeable. So when they
Yes.
engaged their local provider, the provider gets a leg up on understanding exactly, oh, okay, rather than asking several questions and wasting time. And if you take AI to the next level with telehealth, basically it's just streaming more knowledge, it's simplifying it, that it could help people out there before they engage even with a telehealth provider. So it's just amazing.
It is.
Uh, what are some of the major changes you have seen in healthcare since the crisis?
You know what? So Nick, I was thinking about this the other day, and one of the things that this is just something that I think is a issue that we're going to have to be prepared for. The impact mentally on our care workers, on our clinical care team that are treating these COVID-19 patients in the way that they are, in this chaotic environment, witnessing such a loss of life and such a, just you see the pictures and the
Very tragic.
videos of what's going on in these hospitals, and it's amazing. And so one of the big things that comes to mind for me, honestly, is PTSD. I mean, you think about 9/11, you think about
Yeah.
some of the terrorist attacks and the school shootings, and the people that have had to witness that
In the
happening.
same way soldiers out in a battlefield, they come back.
Yes, yes. So one of the things that I think, from a mental health standpoint, our clinical staff, there's going to have to be a focus on that situation, because I think that we just need to be prepared to make sure that they're mentally healthy following such a traumatic situation. Because when you think about the mentality of a normally a health worker or a healthcare worker, a physician, they thrive in making someone better. And if someone is not getting better, they feel like they've lost, that they failed. And
Exactly.
it's a real situation that we need to look into. So that's one thing that I think
Eh,
about. I mean, I think the other thing we mentioned on a little bit ago is just the pipeline of healthcare and trying to figure out how do we increase the pipeline of healthcare potential, candidates, students, starting to focus in high school and elementary on the value of healthcare workers, maybe increasing the salaries and income so that we have more in the future.
Exactly.
Because the issue that we're running into, we see it right now, is the inability to scale up. We can't scale up to meet the demand. And the last thing that we want to have is a situation where we don't have enough people to service or help the ones that are in need. So, and then finally, the increasing use of contingent workforce, the increase in use of staffing companies like ourselves. Again, trying to scale up to meet that need. There's not going to be a quick enough process to hire someone in a traditional way. They're going to have to go to a staffing situation to get those people in to meet those needs in a fast-paced manner.
Exactly. And I've seen some medical institutions start apprenticeships where they would bring in someone out, say, the nursing program, say in a high school BOCES setting, and to help bring them in to get them trained up to speed and so on. But you're absolutely right, Stephen. We are going to have to increase the number of people, particularly across multiple areas of clinical care. Because to me, I see it like just-in-time resources or just-in-time manufacturing. We need to have the correct resources. There is a growing notion about Silicon Valley entering in-home care. So do you see big companies like Apple, Google, and Microsoft venturing into digital healthcare?
Absolutely. Yeah, no doubt. No doubt about it. There's definitely going to be a move to, and I think that they're already moving in that direction. We're going to need those companies to help push our technology and to get us to where we need to be. Really
Exactly. Exactly. Just as an add-on question, do you foresee, because I come from these tech companies, but do you foresee tech companies that have been in the field, say, supplying EMR systems like an Epic or a Cerner? I know Cerner is very aligned with Oracle, but do you see even Epic changing, because it's more or less like a black box, but being forced in a polite way to change its approach into work in collaboration with an Apple, Google, Microsoft, etc., the way Cerner does with Oracle?
Without a doubt. I mean, it always makes me think about the story of Blockbuster and Netflix. Some of our older, our younger viewers may not know that story, but I mean, Netflix, which obviously is a multi-billion-dollar company right now, and is a huge part of everyone's lives. Blockbuster was an old school video VCR kind of company. And at the time when Netflix was just starting and had the concept of going online for movie rental, they approached Blockbuster and wanted a Blockbuster to acquire them, right? And Blockbuster missed the boat, didn't see it coming, thought that no, people still wanted to touch and feel the cassette and put it into the VCR, and or the DVD. They wanted that whole experience. And needless to say, Blockbuster is no more, and Netflix is one of the Fortune 100 companies that we're dealing with right now, and that is because they saw the future, they understood the future. So these companies are going to have to get on board, or they're going to be left behind, and you don't want to be the Blockbuster of the healthcare industry.
Exactly, and companies just like with Netflix that you noted, basically they saw how disruptions in technology have taken hold and it's increasing, and by leveraging that disruption, a whole new business model, which makes companies like Blockbuster, well, it's history that they're past tense. Is Sterling Staffing Solutions work closely with therapists? How do you see things changing for them post COVID-19?
Yeah, so that's an interesting question. I think that there is going right now, because of the uncertainty in the healthcare industry, from that standpoint, from a home health situation, there is a lot of push and clamoring to go to more stability, to being in healthcare areas that's more stable, and that there's no uncertainty right now. I think that, especially in light of COVID-19 and whole impact I think that overall we're going to see a less risky or a risk adverse, clinical team that's going to want to be in a place that they know that whether or not the salary is a lower amount or not, they just want to make sure that they're going to have stability, that they know that they're going to have their job, that they're safe, and whether or not it's a governmental job or some other traditional job, they're going to want stability. And I think that that's going to kind of affect the ability to get people to kind of think outside of the box, do something new, take a little risk. And that may be the case for a little while, but I hopefully that will change. But I think the normal, the kind of gut reaction for people will be what's safe.
Exactly. Exactly. The next question is, it's really a loaded question, Stephen. When you look at physician burnout, of course, we could say burnout, nurses, lab technicians, pharmacists, but when you focus on physicians, their burnout has always been a major issue in healthcare, and the pandemic has exacerbated the situation. Can telehealth make things better for physicians to decrease this burnout?
Yeah. I think yes and no. I think telehealth, again, it's kind of like what we talked about earlier with the move. The impact on our company has been that we've moved from the office environment to a virtual environment of working from home. And I don't know about you, Nick, but I'm sure you would say the same thing. I'm probably working 12-hour days now. I've always worked a lot of hours, right? But I mean, now it's just so convenient. The hour that I would normally take to get dressed and to go to work, and then the hour that I would from commuting from work home or whatever, that's all work time. So it's from a telehealth perspective, I think what the pressure will be that physicians honestly will see more patients, will do more. It will just be an easier method to make that happen. So will it ease physician burnout? I honestly don't know that it will. I think that ultimately we still need to have, we need to fill that shortage gap. We need to have more physicians, allow them to have more quality time with their patients because of the pushes of insurance, because of private insurance and HMOs and all of this. Physicians are being pushed to do more with less. So,
exactly.
A normal doctor's visit that they may want to have happen, take 30 minutes, they're being pressured to do in 15. And with telehealth, it may be 10. It's tough. It's the influences of cost is amazing.
Exactly. And when we say physician burnout, what we're focused on is, in the old days, the MD, the medical doctor, the general practice that would in the old days come to your house. That was many years ago. That's where, to me, that's the first line of defense, having the MDs work with patients. But I don't see it as much like in the different types of specialties, cancer surgeon or something of that nature.
Agreed.
Okay, so Stephen, your answers have been phenomenal, and they've been right on target. You're welcome. The next question. States have relaxed and even wavered in the state licensing requirements, allowing healthcare providers to practice across state lines and assist patients impacted by COVID-19. Let me add something else. Also, allowing physicians from different countries to come into the U.S. There used to be more stricter guidelines, or you had to do a residency or something. So let me throw that thought in. So basically, do you feel this should continue post this crisis?
There is no doubt that it should continue. No doubt
Yes.
that it should continue. I think that, you know, it's beyond me, to be honest, that every state licenses their clinical personnel, and of course, there's the belief that one state's, you know, I know Texas, you know, being from Texas, you know, I think Texas, we think we're our own country anyway. we
Excellent point.
believe, right? We believe that no one else is smart enough to figure out how to run this thing. So, but no, I think there should be a national licensing board for all clinical, professions. And if you're right, if I'm a doctor licensed in Texas, I could, or licensed in America, I can go anywhere. And from a global standpoint as well, I can tell you that we have a number of clinical teams from global standpoints, right? I have a number of employees that work from the Philippines. They're physicians in the Philippines, and they come to the U.S. and they have to be a registered nurse or something like that, because those things. And these personnel are extremely talented.
Yes.
If we could figure out a way to do some type of global licensing, that would be outstanding as well, because I can tell you,
an excellent point.
There's some personnel globally that could run circles around some of our personnel here in the States.
I've seen that. And, you know, it only coincides with the fact, since we're a global economy, why
Yes.
not include clinical care or medical in general, as it should be looked as a global concentration of how resources can be shared regardless of national boundaries.
Absolutely.
The last question, and again, Stephen, thank you for your time, and your answers again have been phenomenal. White Orchard specializes in palliative care and hospice services. Have you noticed any marked differences in the use of these services in the last few weeks or since COVID-19 entered the scene?
Yeah. So, unfortunately, yes. Obviously the impact, if the definition of hospice services we provide comfort care to terminally ill patients that have been diagnosed with some type of illness that at this point they have attempted all life-saving measures and have been informed by their physician that there's nothing more that can be done, and they're just waiting to let life run its course. And so our goal is to make them as comfortable as possible. The unfortunate thing is that we have seen an increase in use of our services for COVID-19 patients. And to be honest, we see it happening. And unfortunately, but before we can even provide comfort, a lot of times these patients have already passed away. But at the same time, though, we do see a decrease in services from people that probably could benefit more quickly from our services, because of, again, the fear of having someone come into their home, or someone come, you have assisted living facilities, nursing facilities, all of these homes that have been COVID, beds of disease, infection. And so, they're not letting personnel in to come and provide those high level specified services. So unfortunately, what's happening in reality is that these people are passing away a very, very horrible death. And our goal as a hospice company is to make that transition very comfortable. So that part I hate, that we can't help that transition to be comfortable.
Exactly. And may I add also the psychological wear and tear on these patients in these nursing homes, the emotional
passing away
trauma.
without seeing their loved ones, without being able to see their loved ones to be able to touch them, kiss them, say goodbye. It's unfortunate.
It is. So again, Stephen, thank you for taking the time to have this discussion. I know I learned a lot, and hopefully everybody out there, which I believe they've learned a lot from you in your guidance and direction. So thank you for taking the time again to speak with us and sharing your insights, which are well valued. We wish you the best success in 2020. At this point, the webinar conclusion. Be sure to visit OSB Labs again to learn more about the healthcare industry. I'm going to open up the Q&A now. And see if there's any questions. Okay, so we have a question from Scott Owens. What is the current biggest challenge in credentialing?
So, I think credentialing, the entire process of credentialing has been one that, again, lacks automation. The process of credentialing a physician across, or a clinician across all the insurances that are required across, Medicare and all these other parties is very, very fragmented. You literally have to go to each panel separately and, apply for that credentialing with those panels. There is a need for advancing credentialing to a standpoint where, again, like there is a universal process whereby all credentialing panels can be accessed by one application and quickly done to ensure that people are adequate and appropriate and credentialed to provide services. So I think that there are already things underway. I mean, we're working on a tool as well to automate credentialing for all clinicians to be able to get approved for all panels in a faster way. But that definitely is something that is changing. We have a website called mymedcred.com that focuses on credentialing. At this point, it is more of a credential storage tool, but we're transitioning to an automated credentialing tool in the future.
So Scott, I hope that answered the question. We have another question from Patrick Turner. The need for temporary nurses have escalated during the pandemic. What should be the long-term strategy to keep these forces in reserve? And we spoke earlier about apprenticeships and so on.
Yeah, exactly. I think we need to make it easier for these backup teams to be able to work across state lines. We need to look at increasing, hazard duty pay even. I mean, we really need to be looking at hazard duty pay across the board for these clinicians that are putting their frontline workers, right? They're on the front lines and they're putting their life at risk just like any soldier would be. And so having a standard process for looking at hazard duty pay for those people would help in these manners as well. I think that there's a lot more that we can do to protect our healthcare workers, to support them, and to make sure that they know that they're valued.
That's an excellent response, Patrick. I hope that question was answered in its fullest. Next question is from Sandra Holt. What's the best approach to deal with staffing shortage situation? And I think this dovetails into what Patrick had asked us.
Yeah, and again, I think it really is leveraging staffing companies. Leveraging staffing agencies. That is what we do. Is we're here to provide coverage to when we talk about physician burnout, when we talk about clinician burnout. When you just need someone to provide a break for your full-time team, that's what these staffing companies are there to do. But I think the other thing is that I think our hospital facilities, our clinical facilities need to have a better approach to utilization of the staff that they have so that they try to avoid burnout. Right? I think having a more even approach to shifts, not putting someone on a 12-hour shift, trying to leverage more, maybe 10-hour shifts, 8-hour shifts, at least giving them some break so that you're not running on fuels for such a long period of time. Because of course, in healthcare, right, the ultimate risk is that when I'm tired, I'll make a mistake, and that may be someone's life at risk. It's unlike any other
excellent point.
Unlike any other industry. If I'm an accountant and I make a mistake on posting a debit or a credit, I'm not hurting and I'm not taking someone's life, right? So it is super important that for our clinical staff that we make sure that they're mentally and physically on board.
That, Stephen, is an excellent point. Life and death, that's what they're dealing with. We have another question from Nia Williams. What's your take on internal education programs to help providers, preferably nurses, on working during this pandemic?
Yeah, so I think I think that obviously there is a need to focus on education as we continue to learn more and more about COVID-19, about pandemic, about pandemic performances and how do we respond and how do we, I think, and this kind of leans on technology. We're seeing this as a nation as well, right? As a global community, how do we respond to COVID-19 in the fastest possible way? And, we talked about contact tracers. We talked about all these other elements that help to alleviate or push down the rate of infection by utilizing technology to get there. And I think that continuing to figure out how we learn from this standpoint, that this situation that we're going into, leveraging that information and just continuing to increase the technology and the data points. Ultimately, healthcare workers can be more efficient and more effective if they know what worked in North Carolina, what worked in India, what worked in Mexico best, and that information comes in as quickly as possible so that we can leverage it immediately.
Yeah, and I found from my own experience, this is where machine learning can come into play to be able to analyze previous situations, looking at one patient or multiple patients belonging to some sort of segment, let's say a chronic disease segment, and being able to help the nurse provide the right solutions, but be efficient and also very, very knowledgeable.
Absolutely.
So we have another question. This person is anonymous. In terms of adopting new technology to automate manual processes, have you tried bringing in technology experts to build your own, or do you primarily look to the technology industry to build solutions for your organization, and why?
Yeah, so so actually OSP Labs, who's the host of this podcast, that's the company that we use, and we've used multiple companies to build technologies for us. So yes, the answer is a resounding yes, that we build our own technology as opposed to using I mean, and it's not that we're against using existing technology, and we do use it in some aspects, but there are certain areas that we feel like we need a customized solution to fit our needs. And from that standpoint, we've reached out and vetted different companies and found companies like OSP Labs to come in and create our technology. And just a shameless plug for OSP Labs. This is my first time working with a company that has been so thorough. These guys are amazing, and I'm not saying that to plug or to just no one paying me to say that. But if you really are looking for someone for a technology solution, these guys are the real deal.
No, that is why I'm working for them, because I was very impressed by their knowledge of clinical and medical. Those two disciplines, they're very, very deep. It seems like we've had some people that have used chat for some reason to pose questions. So I'm going to move to the chat, okay? Okay. Let me just do this. Okay. Uh, so we have a question from Paul Belkin. What are the challenges faced during staffing operations when the data access is limited?
So yeah, that's a good question. I think that, you know, what happens when you're a technology, a company that leverages technology seamlessly, and you know, it is our thing, right? So we have had, over the last several months, we've had some downtime from a technology standpoint, and the data that we needed wasn't there. We've had some website crashes. We've had some server crashes. I mean, that's technology, right? It happens from time to time. You can think that you're not vulnerable from that kind of thing to happen, but you can be, and it can be challenging. You know, what I would say to everyone, I think what we've learned as well is that you always got to have a backup plan, right? You just really do. And sometimes it's just, you know, you think about the voting machines. We're about to have a presidential vote here in a little bit.
Mm-hmm.
You know, one of the things that they do a lot is that there's always a printout of a paper ballot just in case it goes on with the machine. And it's just a sample of what happens. You know, technology is technology, and it's great when it works, but when it doesn't, if you don't have a backup plan, it puts you in a bad spot. So I would advise everyone to always have some type of backup plan, either a backup system, or even if it's just a backup system or a manual process, to make sure that if your system goes down, you've got a recourse.
Exactly. So we have a question from the chat from Sam RF. I probably mispronounced your last name, Sam. I apologize. The question, Stephen, is the trend for technology now in the future for the aging population, old chronic disease patients, monitoring and chronic care management. So basically he's asking, what are the trends in technology to address, as you and I spoke before this webinar, about the baby boomers aging?
Yes. So, you know, I think the trends, and I don't know that there's a specific technology change specifically to baby boomers, or you know, we know that. Here's what we can say: we know that we have an increased level of retirees coming out of the baby boomer community. We have an aging population that will be dealing with chronic diseases, and so there's going to be a need for, like as you mentioned, focusing on chronic disease patients. But the biggest change is that the longevity of people, right? What we know now is that someone, you know, a diabetic, or someone with COPD, or someone, you know, with CHF, they're living a lot longer than they would have 10 years ago, 20 years ago, whatever the case may be. So the cost of caring for a patient like that is going to increase. The type of medication, the protocol, everything that's going to be needed to keep that patient going is going to increase. So trying to make sure that we have a quality of life for those people in the long term is going to be you know, really important. I think that as we look at senior living, long-term care facilities, things of that nature, they're going to have to implement a more clinical-based approach to make sure that they can take care of those aging patients that are going to be with us for a longer period of time. They're not going to be able to live independently, so they're going to have to go to some of these facilities. How do we make sure that we take care of them for a longer period of time?
Yeah, that's an excellent point, because when you look at the, as I like to say, the bookends, you have pediatrics, those that are young, but then you have geriatrics, those are towards the end of their life. And those are two big groups, or I like to say bookends, where the approach of clinical care and the treatments and so on, they take on somewhat of a unique set of methods in order to approach those two groups.
Absolutely.
So we have a question from Vincent Cano. Is working from home the future of work, and how you see the future of staffing, the staffing
Yeah.
industry?
Yeah, there's no doubt that, the one thing that COVID-19 is definitely changing the way that we live our lives from this point forward. There will no
Mhm.
doubt that my estimation is that 50% of the people that are working from home now will never go back to a normal workplace environment. So there's not a doubt that we're going to continue to have a work from home contingent for a long period of time.
Mhm.
Just honestly, from a cost perspective, from a business owner cost perspective, if why have a huge office that houses 100 people when I can have half of that space? Because what businesses are doing right now is they're going through and they're looking at every employee that they have, and they're trying to determine which employee and what work element do they do that allows them to work from home versus to be in the office. And I'm only going to keep the people in my office that have to have face to face. Everyone else, you can be in a virtual environment. So that is going to be the situation for the long haul. From a staffing industry standpoint, same situation. We'll be able to staff employees out that work from home, and it's just going to be the new norm. The big thing is going to be, again, leveraging technology. I think companies like Comcast and some of these other companies, in terms of making sure that Wi-Fi connections and security and cybersecurity and things of that
Exactly.
nature are really important as we continue to have a combination of sharing confidential data across networks from
Mhm.
office to. But yeah, it's the new norm. That's where we are.
Yeah, and it's a lot cheaper, the expense for an ISP and any sort of special technologies you need, minus utilizing, say, like the cloud for Office 365, compared to a building. There's overhead and so on. Um, so the next, we have two more questions that came across the Q&A. Okay, this one is, what about working from home medical staff like me? I am a medical lab technician and medical coder. How can I contribute myself in healthcare system?
Yeah, so I mean, I would tell you that there are a ton of companies out there right now that are specifically looking for medical coding, and they're doing it. You're doing it from home. I
Mhm.
mean, and actually, in your industry, medical coding has been something that's been virtual for some time now. I would just encourage you to go out and try to find, do a search for companies that are looking specifically for virtual medical coders.
Mhm.
You can also promote yourself. You can go to websites like Upwork.com or Freelancer or some of these other, websites, and promote yourself as as an independent contractor that does your own thing. So whether or not you go to a traditional company, to a staffing company, or you become your own independent contractor and
Mhm.
promote yourself, I think there are a number of ways for you to work virtually as a coder, and to make a good living doing it.
Excellent point. And I believe we touched upon this before, but from Natalie Wichita, her question is, how are you planning to overcome healthcare talent shortages? And I know we spoke about it during the course of our questions and also
Yeah.
putting forth these questions.
Yeah, and I think again, I think that we're going to continue to try to find personnel, even right out of college, maybe entry level, provide a lot of training to them,
Mhm.
training for them to get them up to speed. I think that we'll
Mhm.
continue to leverage global talent as well. So
Mhm.
bringing in people, from other countries to service and help us out. I think that there are always a lot of people that reinvent themselves later on in life, and
Great
so
point.
yeah, encouraging those people that want to go back and change their career and do something different. But yeah, we'll continue to do that, and to recruit at a high level and make sure that everyone we bring on though is passionate and provide quality care.
Yeah, excellent point, Stephen. This question from Michelle O'Donnell: as an established staffing solutions provider, what simple tips would you like to give us on staffing practices?
You know, I would say that, staffing is really about getting the best personnel, the best people possible.
Mm-hmm.
And your name and your reputation is based upon the skill sets and the performance of your team. And so many times it's crazy that, we've employed thousands of employees, right? And our clients can get one bad experience with one clinician. And instead of it being looked at as it just being that one clinician, it's Sterling Staffing Solutions. It's an impact on the entire company. And they expect that you provide, you say that you're going to provide quality, you stand by that. That means that every person you put on the job has to provide that kind of quality. So I would say the biggest challenge is trying to recruit the very best, making sure that they follow your protocol, making sure that you have a Q&A, a quality standard that you're going to use to ensure that they're going to meet those needs, and to make sure that you're continuing to be in communication with your client and to have an open communication line so that they can let you know if they have any issues, if they have any concerns, you'll be there, right, as proactively as possible to address those, to make sure that the ultimate goal is for both the client and for our company to be happy.
And this is the last question. What's your opinion on telehealth being leveraged for provider safety? Will it be effective? Now, I know we touched about the safety of healthcare workers going to their patients. So again, what's your opinion on telehealth being leveraged to mitigate safety issues?
Right. Yeah, so definitely, we see that happening already, as I'm sure a lot of people experience as we started to kind of come out of COVID-19 the first time. There were a number of physicians that were doing, kind of general follow-up physician visits by telehealth to ease the amount of interaction. They were only allowing interaction for critical level type of visits. I think that will continue to be the situation for the long haul. Telehealth is really not just is it a safety situation for both the clinical provider and the patient. It's a safety situation for both, but it also is a way to make care more efficient. If I'm a very busy engineer, busy lawyer, whatever the case may be, and me as a busy executive, to be honest, I'll miss a doctor's appointment. I miss appointments all the time. I mean, it just happens, right? But if I was able to check in, telehealth, and all I have to do is at my computer, stop what I'm doing, have a HIPAA compliant call that is safe and secure, confidential, and I can do that for 20 minutes, and I don't have to leave my office, and I can get right back to work. The likelihood of me being able to keep that visit is much more likely. So it's a win-win for everybody.
Yeah, and we've seen it like in the financial industry for years, leveraging technology, general banking, now even investments. Stephen, I would like to thank you very much. I've learned a lot. I know that the viewers, the attendees rather, have learned a lot, and it was an honor speaking to you. You have an excellent, diverse background. You brought a lot of value to this first webinar. And again, Stephen, thank you very much for your time.
Nick, I can say that I've been on a number of podcasts before, and having a host that is as knowledgeable as you are, being able to circumvent and to guide through all of the Q&A and the topics. You did it seamlessly, and you are a scholar and a gentleman, and I appreciate you.
Thank you. You too. Stephen, you take care. And again, thank you everybody out there for attending.
Absolutely. Thanks for joining on, guys.
Take care.